This video will explain to you what you need to know about wet age-related macular degeneration. Please be aware that this content is for educational purposes only and does not constitute medical advice. This video will explain how the eye works, explain wet AMD, discuss its treatment, and how to decrease the changes of the other eye developing wet AMD. Please be aware that this content is for informational or educational purposes only and does not constitute medical advice. Please discuss any of your questions or concerns with your eye care professional. The eye works like a camera. It has two parts, a lens and a film. The film layer lines the back wall of the eye and is called the retina. The area of the retina responsible for the central vision is called the macula. Age-related macular degeneration, AMD, refers to specific age-related changes in patients 50 years and older. Wet age-related macular degeneration is characterized by the formation of undesirable abnormal new blood vessels underneath the macula. These blood vessels have a tendency to leak, which decreases the quality of vision. Furthermore, if left untreated, these blood vessels may bleed or form scar tissue, which may lead to a permanent decrease in central vision. Wet AMD comes in a spectrum from those who have driving-level vision upon being diagnosed to others who are legally blind. The treatments available improve vision by 1 to 2 lines initially and then maintain vision for many years. Treatment results vary for each eye. The treatments available are treatments, not a cure. This means that patients will continue to need treatments indefinitely. Treatments are typically initiated every 4 weeks. The eye is monitored for its response to the medication, and the time interval between injections is adjusted appropriately. All treatments for wet macular degeneration are administered by an intravitreal injection. An intravitreal injection is a safe in-office procedure in which a medication is injected into the vitreous cavity of the eye. This can be performed in a manner that causes minimal or no discomfort to the patient. Intravitreal injections are the only method available for the effective treatment of macular degeneration. The eye is typically sore after the injection, but usually feels much better by the following day. Most patients undergoing intravitreal injections find that the procedure is much more comfortable than anticipated, and that the post-procedure discomfort is minimal. The goal of treating wet AMD is to preserve vision, prevent it from developing in the other eye, and catch and treat it early if it develops there too. AREDS, 2 vitamins, can decrease the risk of developing wet macular degeneration in the other eye. AREDS 2 vitamins are not the same as multivitamins. Check with your doctor before combining them. A healthy diet with leafy greens, omega-3 from fish, and maintaining a healthy weight can slow macular degeneration. Polarized sunglasses may also help protect your eyes from sun damage. Smoking increases the risk of macular degeneration, worsening by 3 times compared to a non-smoker. Discontinuing smoking decreases this risk by 50%. If you have dry macular degeneration in one eye, using an Amsler grid can help catch changes early. New distortion or blurriness may signal wet AMD, and early treatment can protect your vision. An Amsler grid should be used to check each eye individually at a reading distance. Patients are instructed to look at the black dot in the center of the grid paper. Patients who notice new distortion or missing lines may be experiencing a conversion to the wet form of macular degeneration. Many patients with wet AMD continue to see well during their lifetime and maintain their independence. Adhering to the treatment regimen and items we discussed will dramatically increase the risk of meeting this goal. Pharmaceutical companies are working on longer-lasting, more effective treatments for wet macular degeneration. Ask your doctor if a clinical trial might be right for you. Please remember, this video is for general educational purposes only. It is not medical advice. Please speak with your eye care provider about your specific situation.